Tonight, we're going to talk about how to get a medical cannabis card specifically in Utah, but I think this really applies to everywhere in the US. Frankly, there will be different recommendations or different kind of qualifying conditions in other states, but here in Utah, we'll be a little more specific about the process here. Topics we'll cover tonight include qualifying conditions. We'll talk about those here in Utah, getting what it actually takes, the nuts and bolts of getting a recommendation, registering with the state, because all medical cannabis programs require a registration with the government. These are all state programs, no federal programs. What it's like to visit a medical cannabis pharmacy or a medical cannabis dispensary, and some tips and next steps that I think are important for patients who, once they get their card, what do we do? It was 2018, the law passed in Utah, and cannabis became decriminalized in Utah and essentially legalized from a state standpoint. But now what, right? So I really want to start with two questions and those two questions are: one, do you know somebody who suffers from cancer? Right. The second question is, do you or somebody you know or that's close to you use a medication chronically? And chronically in the medical community means more than 3 months. So if you're on a medication longer than 3 months, that's considered in most medical schools a chronic medication. And it seems like almost everybody is on a chronic medication. And a lot of those medications are for symptom treatment: depression, anxiety, pain, acute pain that is quick, like from surgery. That's acute pain. That pain goes away. But chronic pain is when the body adjusts the sensation, and now you're having a pain response, but there's no physical problem, maybe. And maybe there is a physical problem, but it's just chronic. So you're on a chronic pain medication. And that's where cannabis, you can kind of start, I would challenge everybody to learn more about cannabis if they know somebody with cancer, or if you have cancer, or if you know somebody who's on a medication long-term, or if you are on a medication long-term. I think that's a good starting place. You can learn more about this. I talked a little bit about this before. Here's a couple of QR codes for Utah in the Weeds podcast and for our YouTube channel, Discover Marijuana. We're into season 4 now on Discover Marijuana. Super fun series this time. And we're getting ready to shoot the second half of that next week. So let's talk about who qualifies for a card. So every state program has a set of qualifying conditions. It's different in every state, but in Utah, there are 15 qualifying conditions. You can see a list of those at utahmarijuana.org/conditions. Or, for example, if you wonder if you qualify, you can go to that link, utmmj.org/prescreen, and see if you qualify. We have a simple self-assessment that you can take. And at the end of it, when you submit, based on your answers, we'll tell you whether or not you'll likely qualify based on those answers. The qualifying conditions in Utah are primarily pain, PTSD, and nausea. Crohn's disease, colitis, there's autism, AIDS, HIV, there's of course cancer, and rare conditions. But of the 15, 80+% of people qualify under the pain diagnosis. This is pain lasting longer than 2 weeks. That's not well controlled with a typical medication. Even if you've tried ibuprofen and it hurts your stomach, gives you ulcers, or if you've had knee surgery and it bothers you over and over, when you're active and you can't find something that works, that's pain that is likely a qualifying condition. If you're diagnosed with PTSD and you're under treatment with a therapist, then that qualifies. And that's a unique diagnosis, because if you look back over the past few years, You look back, especially in Utah, where we have had the earthquake a couple of years ago now. And worldwide, we've had the COVID pandemic, which has caused a lot of trauma. People have missed school or not been able to work, had really hard things happen to them. There's, I can't say it's 100% of the time, but boy, we have a lot of PTSD in our society. And trauma-based therapy is a really growing field. And we specialize in that at Utah Therapeutic, have an entire department and program that surrounds PTSD and cannabis-based therapy. Nausea is another one. And what's interesting about nausea, for example, is anxiety might cause nausea. So people can sometimes qualify with a nausea diagnosis really as a result of another process that's happening. The most important thing for this is really, if you have a question about whether or not you qualify, you just need to ask, right? Just reach out and ask us online on our chat. Go seek it out, because if you think you don't qualify, you'd probably be surprised. Let's watch here.
Hi, I'm Sabrina, and I started using medical cannabis for chronic foot pain that I've been dealing with for more than 10 years. I am so grateful for the pain relief that it's brought. It's really been life-changing for me. I play a ton of tennis, I do yoga, I started running again, and it's been so helpful. So I'm grateful for the health and wellness that it's brought to my life, and recommend it for anyone that's dealing with these kinds of issues.
Yeah, Sabrina, if you've heard that, here's a really active woman. She just wasn't getting relief from the medications that she was taking. She plays a lot of tennis and really has just found that medical cannabis is a natural alternative to what she was using. It seems to work better, and it works. A little over 79% of our patients find that they're using less medications and less alcohol within about 90 days to 6 months of starting medical cannabis. I don't think that's organic. I don't think that happens just out of nowhere. I think that requires a little bit of tweaking and education that's very specific to how we do things. I think we really focus on that, and that's why you see these really big numbers. Here's a really short video about, that breaks down the card process from the beginning.
Getting your Utah Medical Cannabis card can seem daunting at first, but now you've got friends in high places, and we've got you. How do you qualify? Let's get into it. The easiest way to see if you qualify is to go to utahmarijuana.org and take a self-prescreen. Hit "See if I qualify" to begin. Then answer a few simple questions about your health history. It's quick and completely confidential. As long as you qualify, you're almost guaranteed a card. Just pick a time to come into one of our clinics and chat with your new qualified medical provider. Now it's time to meet your friendly neighborhood QMP. They'll ask you questions about your condition and your past experience with cannabis, if any. It may feel scary to talk about your cannabis use with a doctor since it's so recently legal, but this is a highly supportive, judgment-free zone. Your honesty helps your QMP get the dosing right. And remember to take this opportunity to ask questions. Your QMP has answers. Then, a member of our team will walk you through the state application to get your card. Once you leave, all you need to do is sit back, relax, and wait for an email from the state with your Utah medical card. Now you're legal, and you can go straight to your closest pharmacy to pick up your medicine. Don't hesitate to use the pharmacist's knowledge and expertise to find the perfect flower, gummy, vape cart, tincture, or topical for your condition. And that's it. We'll check in with you from time to time to make sure your treatment is going well. Keep an eye on your email. We'll send you appointment reminders, health history updates, and tips for getting the most out of your treatment. We're here to help you feel better. utahmarijuana.org. Feel better.
That's really an overview of the process from start to finish, and a good way to simplify it. And I really do think that it is that straightforward. Let's talk a little bit about how that recommendation process goes. So once you've explored, or once a patient has explored and thought maybe cannabis is right for me, or I want to try it, I'd like to explore it a little bit more, I recommend finding a trusted QMP, a qualified medical provider, somebody who's licensed in the state where you live. Here in Utah, we call them QMPs. They're certified to recommend medical cannabis here in Utah. I recommend finding somebody who specializes in cannabis. I don't think a normal provider has the knowledge, the broad knowledge of the different products, the drug-drug interactions, the science and the evidence behind it. I think there's a lot of stigma still in the quote-unquote traditional Western medical clinics against medical cannabis. So I like specialist. I am one, of course, that's a biased opinion. But I think the evidence that we have that people are reducing the other medications they take shows that it's worth going to somebody who specializes in it. We create personalized care plans with patients and really describe the dosing and delivery to help people tweak their use. For example, if somebody is brand new to cannabis, we'll start them out on a recommendation of a low tincture dose, an oil, cannabis oil. And if somebody is using, say, an ounce of cannabis, a mason jar full of cannabis, every few days, something like this, where I have my black licorice candy. And, I think that patient can benefit from tweaking their use and adjusting what they're taking to help their lungs and the inflammation. And really, we try to meet patients where they're at. We try to follow through on that treatment protocol, checking in with patients as the state requires and as much as the patient really wants to. And I think that's important to find somebody who is engaged, right? Sure. And really a good way to see that is really just read their reviews. Rochelle said to us that she had an amazing experience. They were so helpful, professional, legit, and educational. Highly recommend UTTHC. We constantly get reviews like this for all of our qualified medical providers. When you're preparing for the appointment, this is a little different than a typical doctor's appointment. You're going to want to sign up on the state's website. In your appointment reminders or in your instructions online, there'll be instructions on how to do that. Fairly straightforward. Again, you'll set up an account with the state's website, sign up. You want to bring any documentation you have, old medical records, MRI reports, CT scans. If you have them, bring them to the visit. Our providers are really happy to look through that information with you and not so much help you find a way to get access to medical cannabis, but really find a way to help you feel better about the condition that you're trying to treat. Come with questions, write questions down, bring somebody with you that can help ask those questions. Know that you're going to be fed with essentially a fire hose with the visit. There's a lot of information from the state's website and all the requirements and the safety information that we give, plus all of the dosing and delivery information. We are going to try to build that into a little paper packet that we'll hand you and you can take home. And then you can go back to the website and the YouTube and the podcast and learn more and more and more on your own time to add to the information that's given in the visit. You want to be open about previous drug use, previous cannabis use, and all the medications that you're taking. It's the other part of these visits that's different is that you're able to be honest with your provider. How many times have you really not told the truth to your medical provider about all of the things you're really doing or not doing? The medications that were prescribed that aren't being taken because you don't like the way they make you feel. Here is an opportunity to change that dialogue with your provider and really just have an open communication about what you want. How do you want to feel better and what do you want to do? You're then going to register again with the state. So that's a two-part process in Utah. A lot of other states have a two-part process where you sign up in the beginning and create that account. And then your provider will go in and make a recommendation in that account through the state system. And then you follow that up with a payment to the state. In Utah, that's a $15 fee. Some states are 25, some states are 50. That state in Utah, or the site in Utah, is evs.utah.gov. And you're going to create a profile, again, submit for certification. That's when the provider goes in and gives you a recommendation, and then you're going to pay that state fee. Let's talk about visiting a pharmacy. Once you get that card through the email that animated video talked about, you're going to be able to visit any Utah dispensary or any Utah pharmacy, medical cannabis pharmacy. So in Utah, they call them medical cannabis pharmacies. Not every traditional pharmacy has cannabis. There's only 15 licensed in Utah. They are all across the Wasatch Front. We have a great website that lists all of them and gives you reviews on all of them at utahmarijuana.org. And I have a pharmacy video here to show you about what that's like. So you have your medical cannabis card in Utah and you want to visit a pharmacy. There's a couple of things that you want to do before you get here. One, you want to make sure you have a little cash, because they aren't going to take your credit card or any other form of payment. You can register for Hyper as HYPUR as an alternative payment method if you want to do that. You want to print out your medical cannabis card as well. And finally, most important, you've got to go online and schedule an appointment to visit with a pharmacist when you get here. Come on. When you get here and walk through the door, you'll be greeted by a person behind the glass. It's a little daunting at first, but don't worry, they're very friendly.
All set.
When you get into the lobby, you'll have to register as a patient, show your card, your driver's license, so that they can check you in. Once checked in, a pharmacy agent will come get you and guide you back to the pharmacist's consultation room. Today, we're meeting with Josh.
Have a seat, Tim. How you doing?
When a new patient comes to your pharmacy, what's the discussion like when they get in the room?
We're going to make sure it's a nice experience for them to come in and have a seat. We're going to be upfront about what we're going to ask them and kind of walk them through the process of how it's going to go in the consultation room. I like to start off by introducing myself and then asking them some of the questions that we're required to ask of them. So we have to, one, go over a medication list with them. Oftentimes the QMPs don't put the medication list in their EVS profile. So EVS profile is the electronic verification system the state of Utah has that registers and maintains the list and database of all medical cannabis patients. It includes all their information, their disease state, their qualifying condition, and their recommendation from the QMP and their limits that are associated with that.
Remember, they're going to talk to you about your medication list, what medications might interact with cannabis, starting new cannabis therapy. Be sure to be honest about your cannabis use, because that's the way they can help tailor the treatment to fit what you want with the cannabis therapy. If I'm scared about different product types or I have no experience at all, is that okay? Do I need to know anything about cannabis before I come?
You don't need to know anything. That's what we're here for as pharmacists in this market, is to educate our patients. And when they leave our building for the first time, we want to make sure they have a clear understanding of how they're going to be treated and how to use the products that they're going to purchase.
Do I have to buy marijuana flower?
No, you don't. So what we have is a system where the patient is going to make the decision. The QMP and myself, we recommend the products to the patient based off of their qualifying condition, but ultimately it's up to you, the patient, to make that buying decision.
This sounds a lot better than what I was afraid of. As a new patient, we have a lot of patients who are afraid they're going to get here, they're going to get introduced to flower and grinders and learn how to roll joints.
Yeah.
That's just not the process.
That's not the way it is, not in a medicinal market. We're going to walk you through the products that are available to you from your QMP that they've allowed you to use, and then we're going to show you how to dose them correctly and when and where to use them. And
when we get done with that consultation, what happens next?
So after that, we'll escort you out to the medicine room floor while I introduce you to one of our pharmacy agents. They're going to be the ones walking you through the products a little bit more in depth than what I can offer in such a short time, They're going to have really going to be able to spend more time with you in that. They're going to go off of the recommendation that I'm giving them and that the QMP has given the patient and help the patient pick the products that fall within that guideline.
After the pharmacist consultation, you should feel comfortable enough to choose a couple of products to start with, like a topical or a tincture or something that is going to work for your condition. If you need something inhaled, the pharmacist will educate you on the appropriate accessories that you might need to use that product. Remember, when you go to the pharmacy, you'll need to bring cash. If you don't have cash, don't worry. They have an ATM at every medical cannabis pharmacy in the state. When you buy your product, the pharmacy agent will go back to their vault and retrieve that product and bring it out to you. Everything's going to be locked and secured in a child-proof package and a smell-proof package, really.
Yes.
And you're going to be out the door. The whole process takes about 20 to 30 minutes, including the consultation time. I know this is kind of scary for a lot of people, but it's okay. You don't have to use products that you don't want to. You don't have to take products that are too strong. Every step of the way, the pharmacist and the pharmacy agents are here to tailor that therapy for your condition and your needs, and also to answer any and every question that you have about the therapy, about other medications that you're on, and you can always go back to your QMP for more information. Remember, anytime you need a dosage increase or you want to buy more cannabis than you're allowed with your QMP's current recommendation, call your QMP office before you come so that they can adjust that dosage in the EVS system before you get to the pharmacy. If you happen to run into your limits on purchasing at the pharmacy, the pharmacist or you will need to call your QMP office. Sometimes that takes 2 or 3 days to adjust your dosing. So trying to stay ahead of that is really important. So you finished with your first pharmacy visit. A couple of tips and tricks for next time. You only needed to meet with the pharmacist once. That doesn't need to happen again. You can always ask them questions later if you need. Be sure to ask if your pharmacist or your pharmacy has drive-through, curbside, or delivery options if that works out better for you. And if you can't get to the pharmacy, you can always ask for a telephone or a telemedicine pharmacist consult so that you can do this from the comfort of your own home.
The other thing that you'll need with the pharmacy visit really is just your ID and your medical card. Most pharmacies, most medical cannabis dispensaries and pharmacies here in Utah require that you print out a card. We can always print one out if you don't have a printer at home in the clinics. And additionally, a lot of them are moving to where they'll accept an ID and a virtual picture of the card check in their system to make sure that that's you. You can select products like shown here in the picture, and again, pay with cash, or now debit card is becoming a much better or a much more available option depending on what location you go to. There's a lot of pharmacies that are using the debit card system. So let's talk about next steps for patients, things that I think are just additional help once you get your card and you've been to the pharmacy, and things that all patients and really all users of cannabis, frankly, all users of any medication should do. Get a journal, keep a simple journal. I think journaling is really important. You don't need to keep a journal that is extensive. In fact, I think the minimum amount of information is more important. You want enough information in that journal that you're getting useful data collection, so to speak, but also a limited amount so that you're going to continue to input that data. For example, I like to write down what I took, how much I took, and a couple of hours later, how I feel. And I don't really keep much more information than that. And I might keep track of the date, usually, because they kind of come in order on my rows. And then I can go back and I can look at what products I took and how I feel 2 hours later, what the dosages are. And I've found that I've changed my dosing structure. I've changed the way that I utilize cannabis because of that that background. When I talk to patients, frequently when we do follow-ups, if a patient has those dosing journaling, then I find that we can help them a little bit more, choose different products or choose products to use a little better and layer things. We get into a lot of really exciting discussions. Keeping track of that sort of thing and guiding your how to do that. You can utilize our guides online. You can find those at utmmj.org/guides. We have a guide for just finding your just right dose. We have a guide for shopping, first-time shopping. We also have a guide on opioids and how to decrease opioids using cannabis in a very specific way. And the last guide that we have that I can think of right now is a guide on resetting your tolerance if you feel like you're using too much. Now, most medical cannabis patients are not using too much and they don't have a tolerance problem. There are a few people who run into tolerance problems, just like with any other symptom medication or medication that's treating symptoms. Our body tends to get tolerant of those things. But recording your experience again will help you when you visit with people or when you review it, knowing that you're using more and how to help with that. So let's just go through the timeline one more time. You're going to, of course, after you've researched this, you're going to go through, meet with a QMP, and then you'll get your card about it really is usually 1 to 3 days after your visit. The state will email you that card. The state statute allows the Department of Health up to 14 days to issue that card. That's really not happening very often. We check in with you at 90 days. That's not a requirement in the state any longer, but I feel like it's good practice, good patient care. We use that opportunity for two things. We use it to check in with our patients. And I think that it's important to find somebody who's engaged with your treatment. We do that because we find that it helps people adjust their dosing, adjust what they're taking. And you know what? We also do a lot of research. And so we use the 90-day to survey patients and to record what's happening. And then we use that to educate the new patients, right? If we're taking intake forms and then we're making that data anonymous, we're taking research data at 90 days, and again at 6 months, then we're gathering data to help move legislation in the right direction for more access because we're proving that it works. At 6 months, the state is going to have your card expire and you're going to need to renew that card. That requires another visit with the QMP to renew that card. That visit can be done telemedicine. That visit can be done in person. Your first initial visit with the provider does have to be face-to-face. You have to be in person for that one. All the rest of them can be telemedicine. 6 months, again, renew your card with a visit to your provider. And then again, at 12 months, you are going to need another visit. Now, at that 12-month visit, Utah says, if you're stable on your medication and cannabis is working fine, then we're going to let you and your provider decide whether a 1-year card turnaround is right for you. And most providers will allow that. We don't charge differently for a year card or a 6-month card. I find that providers, we should be doing things for our patients, not based on the cost or the revenue for the visit. So that's really the timeline. You're going to meet with the QMP, get your card right after that. 90 days, we're going to check in with you. 6 months, we're going to see you again. 12 months, we're going to see you again. And then we're going to at least see you once every year, depending on how that goes. So that is essentially the overview of Utah's medical cannabis program and probably most cannabis programs, depending on where you're at and what the requirements are. We've gone over the qualifying conditions. We've gone over meeting with a QMP, why cannabis might be a good idea to explore, how good we're doing and how good our patients are really doing with coming off of other medications. We talked a little bit about meeting with the QMP and what to expect, and then what it's like at the pharmacy, meeting one of the pharmacists, Josh Fitzgerald, who I think is one of the best cannabis pharmacists here in Utah. Any questions that you have, feel free to comment below in the comment section of this video on Discover Marijuana on YouTube. Make sure that please subscribe to the channel if you enjoy the content and you find value in it. You can also follow us on social media. We're everywhere, everybody else is: Twitter, Facebook, Instagram, other good places to reach out to us. And, like I said, I think the comments on YouTube are fantastic. The reason why I love them is I find that we don't have to just answer the question for you. We can answer it for everybody and share the information with everybody. I'll open it up for any questions that we have here live. One of the questions that we get is, can I have a card and a gun? This is a really common question that we often get, and that's a real tricky situation. First thing I would say is I'm not a lawyer, so I can't give legal advice, but we also have videos on the Discover Marijuana YouTube channel with JD Larson, the leafy lawyer, who goes through this. I also have an episode with JD on the podcast on Utah in the Weeds. Just search JD Larson on our YouTube channel and you'll find the video and watch that. He goes through the fact that the truth is you really can't purchase a gun and have a cannabis card because you have to fill out a federal form. You can own a gun in Utah and have a cannabis card. Concealed carry permits, again, it gets tricky. And not likely really legal, but there's nobody who's been prosecuted about it. So I encourage you to find out more. And if it's something that's really important to you, then you're going to want to talk to an attorney about your specific case. We do know there are a lot of people with guns and cannabis cards who are not getting in trouble. I think, the bottom line is, be smart about whatever you're choosing to do. Cannabis is not technically legal anywhere because it's always federally illegal. So we're always running some risk, even by participating in a program, even though the feds have left states alone for decades now. There's another question. Are there any laws in Utah that would prevent a care center from being able to get medical cannabis card? So interesting, very, very interesting question. There has been a lot of new outreach to care centers here, especially in Utah. There are care centers in Florida and California that we know of that are able to utilize cannabis. Nurses, because the nursing licenses, nurses are not going to administer cannabis to a patient. That's all really done by the patient themselves. The facility needs usually to stay at arm's distance from that, from a legal perspective. But we have found that if you ask the questions to the right people in a compassionate way, almost always they're allowing those patients to have and utilize medical cannabis on their own or with their family, being the administrators of the cannabis, which is really cool. And it's a big step forward. Does the VA recognize, and hopefully that answers your question. We can talk more about that specifically. If you have specific questions, reach out to us. Does the VA recognize and allow cannabis therapy? So good question also. The VA does not recognize cannabis as a therapy. However, the VA, there are two things that are really important about this. One, the providers at the VA have grown more and more accepting of cannabis and do recommend it, recommend their patients go find a card somewhere for whatever condition they have. And there is a federal law that will not allow veterans' benefits to be stripped or reduced in any way if they're participating in a medical cannabis program. So as a veteran, you can feel safe utilizing cannabis in a state legal program, and not worry about those benefits being stripped away. They can't take them away. And that's a federal protection. And the state has been really good about that. Utah has also protected teachers, police officers, and public servants, people who work for the state and local governments in the statute, and helped them where the state looks at this like any other prescription medication and is protection. I will say that private employers do not have that requirement and can test and fire people based on a positive THC test. I have a video on that as well, and I encourage you to watch that and read our blog articles at utahmarijuana.org about testing. If you have any other questions for us, please don't hesitate. You can call us. Our phone number is on our website at utahmarijuana.org. And again, comment below on the videos. I appreciate you all watching and coming to this information session. Please share this with anybody that you feel like is kind of curious and interested in this. We really want to just help people find a way to feel better, find a way to use less prescriptions, use less alcohol, change their life one person at a time.